Hello, my name is Ulriikka Chaput. I work in the endoscopy unit in Saint-Antoine Hospital. I would like to thank GIE to have accepted my article entitled Success Rates of Fiducial Markers Placement for Treatment of Esophageal and Rectal Cancers, a prospective multicenter study, FIDECHO study. The idea came from a discussion I had with the radiotherapists I work with. They expressed the need to have a precise localization of esophageal and rectal tumors to help carry out their treatment. Therefore, I decided to conduct a study to determine the feasibility and safety of fiducial markers placement under EUS guidance in these two indications. It was a French prospective multicenter study conducted with the help of our research network named GRAPH. The primary endpoint was the success of fiducial markers placement under US guidance, using the preloaded 22-gauge Ecotip Ultra fiducial needle from Cook Medical. This needle is preloaded with 4 gold markers measuring 5 millimeters. The success was defined by the ability to release fiducials at least at the proximal and the distal ends of the tumor. Endoscopists were encouraged to place an additional fiducial marker on the lateral edge of the tumor to facilitate triangulation of radiotherapy beams. Secondary endpoints were the adverse events rate, length of procedure, and fiducial markers remaining throughout the duration of radiotherapy. 33 patients were included in this study, with a mean age of 64 years. 66% were male. 20 patients had rectal adenocarcinoma and 13 had esophageal malignancies. The success rate of fiducial marker placement was high, up to 93%. The procedure was short, about 12 minutes. The number of fiducial markers placed for each patient were 3.8. And an antibiotic prophylaxis was mandatory. A very important point was that no immediate or late adverse events were reported. There was a high mean number of 3 fiducial markers still visible per patient at the end of radiotherapy. These results are encouraging and provide data for 2 specific indications: esophageal and rectal cancers. Fiducial markers seems to offer significant advantages. Their ability to improve targeting accuracy and aid in tumor localization are an asset in radiation oncology. Despite the potential benefits, one of the main concerns is the risk of migration over time. Fiducial markers have better sustainability over time compared with through-the-scope clips, as 70% were still visible at the end of the radiotherapy. A mean number of 3 fiducial markers were still visible. Regarding esophageal and rectal tumors, the other available studies, essentially retrospective and monocentric, include various GI tumors, but we focused on 2 indications. Our study has also limitations. First, despite the unprecedented sample size, the number of patients is limited. Second, patients with esophageal structure cannot benefit from the technique, as the EUS cup cannot reach the distal end of the targeted tumor. No marker can be placed at the distal part of the esophageal tumor. A study on esophageal cancer, FIDECHO study, published in 2022, provides new data. This study aimed to assess the impact of fiducial marker implantation on conformal chemoradiation therapy, planning in 15 patients with esophageal cancer. They observed a significantly positive impact on accurate volume delineation and modification of the gross tumor volume dimension in 100% of the cases. Combined with our study, we believe the possibility of fiducial marker EUS-guided placement should not be overlooked. However, new studies are warranted. Cooperation between gastroenterologists, endoscopists, radiation oncologists can improve local treatment of esophageal cancer. In rectal cancers, fiducial marker placement could be interesting in small tumors, especially after endoscopic submucosal dissection. In cases of unfavorable histology, an additional treatment such as radiotherapy may be decided, especially in patients with comorbidities. However, the resected lesion is no longer visible on imaging. The placement of fiducial markers is essential to better guide the radiation oncologists. In rectal cancers, new treatment schemes are likely to emerge in the next few years. In conclusion, this prospective multicenter study highlights the very high success of EUS-guided fiducial marker placement for the treatment of rectal and esophageal tumors with no adverse events and a short procedure time. These markers are clearly visible on imaging and remain in place over the time during the course of radiotherapy. Thank you for your attention.